Welcome, everybody. Good morning or good afternoon, whichever applies to you. I am Brian Masters. I'm a client manager here at Xpio Health, and I'm going to be your host and troublemaker for today's session. We're thrilled to have you join us for what promises to be an enlightening and transformative journey as we help you learn to love your EHR. I know what you're thinking. You're saying, love my EHR. Now, that's a bit of a stretch, but trust me, we've been there. In our years of experience, we have seen countless healthcare organizations view their EHR systems as necessary evils, cumbersome tools that seem to create more problems than they solve. But what if I told you it doesn't have to be that way? What if instead of being a source of frustration, your EHR could become a powerful ally in delivering exceptional patient care? That is exactly what we're going to do here today. We're going to learn to love our EHRs. Throughout these sessions, we're going to challenge you to reframe your perspective on EHR systems. We're going to dig into strategies for optimizing your EHR, not just in terms of technical performance, but in ways that genuinely enhance your day-to-day work and the care that you provide your patients. Our goal is ambitious, but it's achievable. By the end of this series, we want you to see your EHR in a whole new light. You may not be ready to send it a Valentine's Day card just yet, but we're confident that you'll be well on your way to building a more positive and productive relationship with this essential tool. So let's start this journey together. Get ready to change your mind about your EHR and maybe even find yourself falling in love with it a little bit, or at least with its potential to transform your practice. Now, let me introduce our panel of distinguished professionals who are going to guide us through this transformation. First, we have Thaddeus Dickson, the founder and CEO of Xpio Health. Thad brings more than 20 years of experience in behavioral health care. He holds numerous certifications related to healthcare security, privacy, and technology. Thad is a recognized expert and frequent speaker on issues related to behavioral health technology and national health care. Next up, we have Traci Crowder, our Chief Operating Officer. Traci has an impressive 30 years of healthcare experience in various roles, including clinical, administrative, and consulting positions. Her expertise spans quality management, IT, risk management, and more. Traci is passionate about helping clients and staff solve problems and making a positive impact. And finally, we have Jill Johnson, our Director of EHR Services. With more than 25 years in the behavioral healthcare industry, Jill has deep knowledge of billing, financial, and the technical aspects of operations. She is the high priestess of all EHR-related projects here at Xpio, and she is an expert in integrating these systems into healthcare organizations' broader operations. Okay, throughout this six-part webinar series, we're going to provide comprehensive insights into EHR optimization. We'll cover its importance, strategies, challenges, and best practices. Each session will build upon the last, offering a thorough understanding of how optimizing your EHR can transform healthcare delivery and outcomes. Today's session is going to focus on the significance of EHR optimization, assessing system performance, enhancing clinical workflows, and ensuring data security. You're going to walk away with actionable insights and strategies that you can apply immediately. And we welcome your questions and comments in the chat. This webinar is not particularly interactive, and I am kind of a long-winded guy. But we have carved out a nice bit of time at the end to field questions and comments. So feel free to ask questions throughout the session, but use the chat feature. And we're going to address your questions during the designated Q&A session at the end of this webinar. Okay. Electronic health records, or EHRs, are digital versions of patients' medical records that provide a comprehensive view of the patient's health history. They facilitate real-time access to patient data and improve care coordination among healthcare providers. EHRs have come a long way since their early beginnings in the 1960s. Initially used for administrative purposes, EHRs evolved as computer technology advanced. The rise of internet and mobile devices in the 1900s and 2000s significantly accelerated EHR adoption. Regulatory milestones like HIPAA in 1996 and HITECH in 2009 further drove widespread implementation and adaptation and set standards for interoperability. Now, in modern healthcare, EHRs play a crucial role in various aspects of patient care. They revolutionized record keeping, right, by providing a centralized, accurate, and easily accessible platform for patient data. And then EHRs also offer a clinical decision support tool through integrated tools and evidence-based recommendations. They facilitate seamless care coordination among different healthcare providers, and they ensure continuity of care in that regard. Moreover, EHRs empower patients by granting them access to their own health records and enabling secure communication channels with their healthcare team. Okay, here's the thing. When we acquire a new electronic health record, we don't know what we don't know. And a newly implemented EHR is not a fully implemented EHR. The journey from implemented to fully optimized is a crucial step in realizing the rewards of your electronic health record. To harness the full potential of EHRs, continuous optimization is essential. Key strategies for optimizing EHR systems include enhancing functionality and user experience, improving interoperability and data exchange, ensuring data security and patient privacy, and providing ongoing training and support for the healthcare staff. Optimized EHRs lead to a number of benefits, such as improved quality of care and patient outcomes, increased operational efficiency and reduced costs. And as we mentioned, enhanced decision-making and better care coordination. By prioritizing EHR optimization, healthcare organizations can leverage these benefits and drive long-term results. Okay, so we see how EHRs have had a transformative effect on healthcare delivery. And as we move forward, EHR optimization will play a crucial role in shaping the future of healthcare. We encourage all healthcare organizations to prioritize EHR optimization efforts to improve patient care while also increasing efficiency and achieving long-term success in the rapidly evolving healthcare landscape. So what is EHR optimization and why should we devote resources to it? EHR optimization is the process of refining and enhancing the use of EHRs to improve behavioral healthcare delivery. It's crucial to understand that optimization is not a one-time set it and forget it event, but rather a continuous improvement process. And as needs evolve and technology advances, EHR systems will be continuously optimized to adapt and meet those changing requirements. Optimization is essential to ensure that EHR systems fulfill their potential to transform healthcare. When EHRs were first introduced, they held the promise of revolutionizing the way behavioral health services are delivered. However, without ongoing optimization, these systems will fall short of their intended goals. Optimization helps EHRs keep pace with changes in practices and in regulations and in technology, ensuring that they remain relevant and effective tools for behavioral health providers. Moreover, optimization is crucial for adapting to unique challenges and requirements of behavioral health. As new evidence-based practices emerge, regulations evolve, and the understanding of behavioral health conditions deepens. EHR systems must be optimized to incorporate these changes seamlessly. Optimization ensures that EHRs continue to support providers in delivering the best possible care for their patients. Optimized EHRs contribute to better patient outcomes by providing enhanced decision support tools. These tools can alert providers to potential drug interactions, and recommend evidence-based treatments, and help prevent adverse events. For example, an optimized EHR can automatically flag potential contraindications between psychiatric medications and other drugs that a patient may be taking, reducing the risk of harmful interactions. Accurate and readily accessible patient records play a vital role in improving the safety and quality of behavioral health care. With optimized EHRs, patients have instant access to a patient's complete medical record and behavioral health history, including diagnoses, treatments, and progress notes. This information empowers providers to make informed decisions and provide personalized care tailored to each patient's needs. Optimization can streamline clinical workflows in behavioral health settings, reducing administrative burden and allowing providers to focus on patient care. For example, an optimized EHR system can automatically generate progress notes based on structured data entered during a therapy session, saving time and ensuring consistent documentation. EHR optimization has a profound impact on workflow efficiency. It can reduce the time that providers spend on documentation by a significant margin, and it enables them to see more patients each day. By streamlining processes, EHR optimization allows providers to focus on more direct patient care, enhancing the overall productivity and improving care quality. Optimized EHR systems can improve the quality and integrity of behavioral health data, facilitating better reporting for regulatory compliance and quality improvement. By ensuring that the data is accurately captured and consistently structured, optimized EHRs enable organizations to generate reliable reports more efficiently. Optimized EHRs often include features like customizable reports and dashboards that support data-driven decision-making. These tools allow healthcare leaders to monitor key performance indicators and identify areas for improvement and track progress over time. For example, an optimized EHR system can generate reports on patient outcomes, helping organizations identify and address any gaps in care delivery. Usability improvements and streamlined processes in EHRs lead to higher satisfaction levels among behavioral health providers. I bet that gets your attention. When EHR systems are intuitive and efficient, providers can focus on delivering quality care rather than navigating complex technologies. This reduces frustration, this reduces burnout, and ultimately it improves job satisfaction and provider retention. Optimized EHRs also enhance patient satisfaction by empowering them with access to their health information and communication with providers. Patient portals, which are a common feature of optimized EHRs, allow patients to view their treatment plans, view their medication lists, and securely message with their care team. This level of engagement and transparency strengthens the therapeutic alliance and leads to higher patient satisfaction and better adherence to treatment plans. So we know EHR optimization plays a critical role in advancing behavioral health care delivery. By improving patient care and enhancing efficiency and strengthening data management and increasing satisfaction for both patients and providers, optimized EHRs have the power to absolutely transform behavioral health organizations. The benefits of optimization are interconnected and they're far-reaching, and they highlight the importance of investing in this continuous improvement process. Achieving these benefits requires a thoughtful approach to overcoming the unique challenges of EHR optimization. In this next section, we want to look at practical strategies and best practices for successfully optimizing EHR systems, addressing the common challenges and ensuring a smooth transition to an optimized state. Let's surface some of the common challenges in EHR use. While EHR systems have brought significant advancements to healthcare, their utilization is often accompanied by a set of unique challenges. It's crucial for behavioral health organizations to recognize these challenges as the first step toward effective optimization and leveraging the full potential of EHR systems. Behavioral health EHRs often face usability issues specific to the behavioral health field, such as complex documentation requirements for mental health assessments and treatment plans and progress notes. These complexities can lead to cumbersome interfaces and excessive clicks and non-intuitive workflows. For example, a provider may need to navigate through multiple screens and menus to document a patient's mental status exam, leading to frustration and increased time spent on documentation. Sound familiar? These usability problems contribute to provider burnout and potentially impact the quality of care. Behavioral health EHRs often face challenges in integrating with primary care systems and other healthcare software, and this lack of integration can hinder the continuity of care for patients receiving both behavioral care and physical health services. For instance, if a patient's medication list is not seamlessly shared between their primary care provider and their psychiatrist, it can lead to potential drug interactions or duplications. Poor integration can also result in data silos, making it difficult for providers to access a comprehensive view of a patient's health history. Some organizations underutilize the features available in their EHR systems for various reasons, such as lack of awareness, insufficient training, or the features not being tailored to specific behavioral health needs. For example, an EHR system may offer a built-in screening tool for depression, but providers may find it too generic for their specific patient population, or they may not even be aware of its existence. This kind of underutilization leads to missed opportunities for early intervention and improved patient outcomes. The challenges in EHR utilization can significantly disrupt clinical workflows in behavioral health settings. Usability issues and poor integration will lead to delays in care and increased administrative burden and reduced time for patient interaction. For instance, if a behavioral health provider spends excessive time navigating the EHR system to locate relevant patient information, it can lead to shorter therapy sessions and potentially impact the therapeutic alliance. Usability and integration issues in EHRs can complicate reporting processes and impact regulatory compliance. Inaccuracies in documentation and difficulties in extracting relevant data hinder an organization's abilities to meet reporting requirements. For example, if an EHR lacks the functionality to easily generate reports on patient outcomes or treatment adherence, it can impact the organization's ability to demonstrate the effectiveness of their services to stakeholders or funding agencies. The cumulative effect of EHR challenges can have a significant impact on the overall delivery of care. Patient satisfaction may suffer if providers are unable to devote sufficient time and attention to their needs due to EHR-related issues. Patient satisfaction may suffer. Moreover, the financial sustainability of organizations can be affected by EHR challenges. If those challenges lead to reduced productivity, increased staff turnover, or difficulties in meeting reimbursement requirements. Going forward, we're going to explore the strategies and solutions available to overcome common obstacles in BH settings. Our coming sessions will focus on targeted EHR optimizations specifically tailored to meet the unique needs of behavioral health providers. Those sessions are designed to show you how EHR optimization can address the specific challenges you face, ensuring that your systems are not just functional, but truly supportive of care delivery. We'll explore practical steps to make sure your EHR works better for you and ultimately improve the care that you provide to your patients. As we focus on optimizing EHR systems, 3 key areas drive success: usability, integration, and feature utilization. Improved usability is about making EHR systems more intuitive and easier to use. When providers are able to navigate the system with minimal effort, they can spend more time on patient care rather than struggling with technologies. Enhanced integration means ensuring that the EHR seamlessly connects with other systems and tools used in the organization. This integration is crucial for providing a comprehensive view of patient data, which supports better decision-making and coordination across care teams. And maximized feature utilization involves making full use of the capabilities within the EHR, such as automated workflows and patient portals. These features not only streamline processes, but they also engage patients more actively in their care. Okay, summarizing. Recognizing the common challenges in EHR utilization is a critical first step toward unlocking the full potential of these systems. By addressing usability issues and integration difficulties and feature underutilization, organizations can optimize their EHRs to improve care delivery, streamline operations, and enhance patient outcomes. As we move forward in this webinar series, we're going to dive deeper into the specific challenges and strategies and best practices for EHR optimization. The next section is going to explore practical approaches to overcoming these challenges and leveraging EHRs to drive excellence in care delivery. But before we go there, I want to introduce you to Traci Crowder, Xpio Health's COO, and the unstoppable force behind Xpio Health's success. With more than 30 years of experience in healthcare, Traci has mastered the art of turning challenges into opportunities. She uses her superpowers to keep the Xpio engine running smoothly. Whether she's optimizing workflows or hiking up a mountain, Traci is all about leaving things better than she found them. Known for a hands-on approach and her infectious enthusiasm, she is the glue that holds this team together, and she is the spark that ignites innovation. And when she's not busy transforming healthcare, you might find her backpacking in the wilderness or driving and banging on the steering wheel as she shouts out the lyrics to her favorite rap songs because, yeah, she's just that cool. Meet Traci Crowder.
Wow. Thank you, Brian. Hello, everyone, and thank you for being here with us today. I'd like to briefly share my experience with optimization, both at the system administration level within an organization like yours, and also at the Xpio consultant level. I've been with Xpio about 10 years. And before that, I was a COO at a behavioral health organization in Washington, where I had responsibility for implementing their first EHR. So going from paper to an electronic system. And many lessons learned there. Most people were excited about the possibilities of moving to an electronic health record, having everything at your fingertips, being able to access information when you needed it. But here's the catch. I learned really quickly that the go live that everyone had either looked forward to or was afraid of was just one milestone in the EHR journey. The EHR journey is for the long haul. After our go live in the organization where I worked, I was hearing a lot of disappointment. I heard that the EHR was adding work. It was taking longer to get notes done. Finding information was challenging. Getting claims out the door was challenging. It was a brand new process. Staff satisfaction was starting to plummet, and I knew it had to be addressed. And I'll just insert here, I started my career as a clinician in direct service, and I wanted to help people. I didn't want to be bogged down with all the paperwork that was required to help people. And when we implemented our EHR, it was the same thing. Staff wanted to take care of those seeking services. They didn't want to spend time fighting with an EHR that just didn't make sense to them or wasn't fitting with how they did their work. They were encountering challenges that they'd never met before. So I was on a mission, and I didn't call it optimization back then. I called it process improvement. But I determined that it needed to start right away, and that the work done beyond go live might be the most important work in fine-tuning the system, continuing the journey, continuing improvement. I learned that this improvement would continue and should continue for the life of the EHR. So at Xpio, we've made this one of our focus areas. And I personally feel very passionate about finding ways to improve systems to work better for the people who are using them, so they can focus on helping those that they serve, the thing that they really want to do. And there are so many ways to improve utilization of an EHR and ways to measure whether that improvement is working. We've helped many organizations improve their EHR, and the process boils down to 3 major steps. One is doing an assessment. And that assessment could be as simple as just listening to what you're hearing about pain points, inviting people to share their pain points, creating ways for them to share that information, taking a look at your workflows, your forms, your reports. Step 2 is identifying all the potential solutions that could make those pain points better. Is there functionality that is available to you but you're not using that would make things easier? Reducing the number of clicks. Brian mentioned clicks earlier. That was one of the early projects I did at that organization, was reducing the number of clicks in an intake workflow because there were so many clicks. Redesigning forms or combining forms so that you have less information to fill out, developing reports and dashboards so that you have better data insight. The third step is to use the information you gain from your assessment and identifying potential solutions to set goals and use that as a work plan. The optimization work plan, should be designed to streamline workflow, increase staff satisfaction, improve client care, and improve data quality. And I'll say, regardless, I know you all are probably on many different EHR systems, and regardless of the EHR, the process is the same for optimization. We have experience in many of the EHR systems, but you carry out optimization processes the same way in any system. And that starts with that assessment, identifying solutions, and setting goals, and continuing that cycle over and over and over again. And I'll end with this final thought. Ongoing optimization of your EHR that you've invested so much money in is crucial. And you can take steps starting right now to find ways to improve how you use your system so that you can focus more on delivering care. And you might not believe it yet, but you might just learn to love your EHR through the optimization process. And that's our hope. So I will stop there and thank you for listening. And back to you, Brian.
See, Traci wants you to fall in love with your EHR too. Okay, let's talk about goals. Setting clear, actionable goals for EHR optimization is crucial for organizations to ensure the success and measurable outcomes. It's important to recognize that optimization is an iterative process and aim for continuous improvement rather than a big one-time fix. By aligning optimization goals with the unique needs of behavioral health, organizations can drive meaningful changes that enhance the quality of and the efficiency of healthcare services. Okay, one of the things I noted earlier, one of the primary goals of EHR optimization is to streamline clinical workflows, reducing administrative burdens on care providers and allowing more time for patient care, right? Specific improvements might include simplifying the documentation process for mental health assessments, or treatment plans, and progress notes. For example, implementing templates and auto-population features can reduce the time spent on repetitive data entry. And this enables providers to focus on delivering personalized care. All right, optimization efforts should aim to make EHR systems more user-friendly and accessible to all behavioral health professionals, including those with varying levels of technical expertise. Strategies can include redesigning user interfaces so they're more intuitive, or providing customization options to meet specific needs of different BH disciplines, like maybe psychiatry or psychology or social work, and ensuring compatibility with assistive technologies for users with disabilities. Ensuring the accuracy, completeness, and timeliness of data contained in EHRs is crucial for informed decision-making and for effective care coordination. Optimization goals should include implementing data validation checks, conducting regular data audits, and providing user training on proper documentation practices. For example, establishing standardized terminology and coding for mental health diagnoses can improve data consistency and facilitate more accurate reporting. Behavioral health EHRs should strive for seamless data exchange and interoperability with primary care and other physical health systems. This is particularly important given the high prevalence of co-occurring mental health and physical health conditions. Optimization efforts should focus on adopting industry standards like HL7 and FHIR and participating in health information exchanges to ensure the sharing of secure to ensure the secure and efficient sharing of patient data across care settings. For instance, ensuring that a patient's medication list is synchronized between their behavioral health provider and a primary care physician can prevent adverse drug interactions and improve care coordination. Optimizing EHRs to meet evolving regulatory requirements and standards is essential for compliance and avoiding penalties. Optimization should leverage EHR functionalities to facilitate compliance with regulations like HIPAA and 42 CFR Part 2, which governs SUD records, and state-specific mental health laws. For example, implementing granular access controls and audit trails can help protect the privacy and security of sensitive behavioral health information. Engaging and considering the diverse needs of all EHR stakeholders is crucial for a successful optimization. This includes mental health providers and patients and administrative staff and IT professionals. Conducting surveys, focus groups, and involving stakeholders in optimization projects can help ensure that the changes align with their needs and improve their overall experience with the EHR system. In summary, the goals and objectives of EHR optimization need to focus on streamlining clinical workflows with enhancing usability and accessibility, and improving data quality and management, and achieving interoperability with physical health systems and complying with regulatory requirements. By pursuing these goals, organizations can leverage their EHR systems to improve the delivery of mental health services and enhance patient outcomes and increase satisfaction among all users, both internal and external. Now, as we move forward, the next section is going to dive deeper into the specific strategies and best practices for achieving these optimization goals in behavioral health settings. We will explore practical approaches and real-world examples of how behavioral health organizations can optimize their EHR systems to drive meaningful improvements in the care and delivery of operational efficiency. EHR optimization is a systematic and continuous process aimed at maximizing the efficiency, effectiveness, and usability of EHR systems, specifically for mental health and substance use disorders treatment settings. It's important to emphasize that optimization is an iterative process requiring ongoing assessment and adaptation to meet the evolving needs of behavioral health organizations and their patients. The optimization process begins with a comprehensive assessment of the current state of the EHR system. This includes evaluating performance metrics, user satisfaction, and alignment with organizational goals specific to mental health and substance use disorder treatment. Benchmarking against industry standards or against similar behavioral health organizations can provide valuable insights and help you identify areas for improvement. Based on the initial assessment, organizations should set specific, measurable, achievable, relevant, and time-bound goals. Those are SMART goals for EHR optimization efforts. These goals should be tailored to the unique needs and priorities of behavioral health, such as improving documentation efficiency for mental health assessments or enhancing care coordination with primary care providers. The planning phase involves outlining the steps and the resources and the timeline needed to achieve these goals and taking into account specific workflows and requirements of behavioral health. Engaging all stakeholders, including patients, providers, administrative staff, and IT professionals, is crucial for the successful EHR optimization efforts. Providers should be actively involved in identifying pain points and for suggesting improvements to ensure that optimized EHR systems align with their clinical workflows and support effective patient care. Patients can provide valuable feedback on features that enhance their engagement and self-management, like online appointment scheduling or secure messaging with their providers. And collaboration with administrative staff and IT professionals is essential to ensure that optimized EHR systems meet regulatory requirements like HIPAA and 42 CFR Part 2, and that they integrate seamlessly with the existing technologies. Implementing the planned changes in the optimization effort may involve software updates or configuration adjustments or customizations and training sessions and workflow revisions specific to mental health and substance use disorder treatment. Clear communication and support during the implementation phase are crucial to ensure smooth transition and to minimize disruptions in patient care. This may involve providing additional resources and guidance to help providers adapt to these changes. Comprehensive training programs and ongoing support are essential for the successful adoption of optimized EHR systems by behavioral health professionals. Training should not only cover the technical aspects of the system, but also best practices for documentation and coding and compliance specific to mental health and substance use disorder treatment. Continuous support, including help desk services and regular check-ins, will help address any challenges or concerns that arise beyond the implementation. Regularly monitoring and evaluating the impact of EHR optimization efforts is crucial to ensure that they are meeting the desired goals and improving behavioral health outcomes. Organizations should be prepared to make iterative adjustments based on feedback from providers, patients, and other stakeholders, as well as evolving regulatory requirements and advancements in behavioral health practices. Right now, I want to introduce you to someone special. Please meet Thaddeus Dickson. Thad is the big brain behind Xpio Health. Thad is a visionary leader and AI innovator with more than 20 years of experience shaping the future of healthcare technology. As our CEO, Thad has a knack for turning complex challenges into cutting-edge solutions, driving advancements that not only secure sensitive information, but also improve patient care across the board. Known for his strategic mindset and his deep expertise in AI, Thad leads with a clear vision, blending technology with healthcare to create transformative outcomes. With a range of hobbies and interests that blur the boundaries between an autodidact and a polymath, on any given day, you can expect to find Thad brainstorming new ways to push the limits of what's possible in the healthcare industry. Meet Thaddeus Dickson.
Well, thank you, Brian. I appreciate that warm welcome, and I appreciate everybody here today that is learning more about how to optimize your EHR. And I think what is important about the subject is that optimization takes a lot of different forms. And I think that the really earlier iterations of EHRs that some of us have been using for many years potentially, they're ultimately transaction machines. And as Traci has mentioned, it's really important that we have an elegant way to maximize the efficiency of those transactions and to minimize clicks. And I think that the optimization process is partly about minimizing those clicks, fixing those workflows. And as Traci mentioned, your workflows likely have changed since you implemented the EHR. And that's really just a point in time, right? Is that big goal that we all push really hard for in our initial implementation. That goal of going live now has likely really had many, many changes take place in the organization since that happened. And sometimes that looks like staff leaving and new programs being created, new payers being added, new services, new lines of service, and all of those things tend to drift from the original EHR configuration. And a lot of times it can leave organizations feeling like they didn't choose the right EHR. And as certainly sometimes that is the case, if you've had a very significant service change and you went from behavioral health care to primary care, yes, you may find some shortcomings in the features of your EHR, but what we find, typically speaking, is that the most prudent place to start is with optimization. And optimization, it allows you to do two things. It allows you to, A, baseline the performance of your EHR to determine if it actually can do the things that you originally acquired that EHR to do. And then B, if it turns out that there is a true gap in functionality, your organization is well prepared to move into a strategic and/or procurement cycle where you could actually go and take those baseline analyses that has been performed and leverage those into requirements for a new EHR. But if during the course of that baseline EHR optimization analysis, it's determined that your existing EHR can actually perform the functions that your organization needs, then you potentially have saved yourself a lot of time, effort, energy, and money, and even grief by basically making the system that you have work for your organization as best as it can. And there's another thing I'll point out there, is that even if you're at an inflection point in your organization and you think it's time for a new EHR, you will have quite a number of steps between actually deciding that you want to get a new EHR and moving and migrating off of your old EHR. And in fact, many organizations use their old EHR in parallel with the new EHR for some period of time. And so back to the subject of optimization, I think what's important to consider is that regardless of where you think your organization might be headed in the future, there's ultimately a really good return on investment to optimizing your EHR today. And that can, as I mentioned earlier, mean not just modifying forms, fields, and workflows, but potentially even integrating a new analytics option, for example, or building new reports that can be surfaced in that EHR to help your staff better avail themselves of the information that is in that electronic health record system. Much of the challenges we see in EHRs relate to getting the data into some kind of actionable view or actionable information, i.e. a report. And there's oftentimes many different ways to creatively approach getting reports out of your EHR that can help solve challenges, make your clinicians more productive, help your financial departments better analyze claims, and ultimately help improve the quality of life with your EHR. Thanks, Brian.
Thank you, Thad. Okay, so there you have it. That was episode 1 in your journey in how to learn to love your EHR. Remember that optimizing your EHR is not just about making the system work better. It's about transforming it into a tool that truly supports your mission. And with a systematic approach, starting with an assessment and goal setting through to implementation and ongoing evaluation, you can unlock the full potential of your EHR. This not only enhances the efficiency of your operations, but it also drives better outcome for your patients. In our upcoming webinars, we're going to cover critical topics for EHR optimization, effective assessments, how to evaluate current systems and identify improvement areas, compliance and interoperability, ensuring that your EHR meets regulatory standards and integrates with physical health systems, and stakeholder engagement, best practices for involving providers and patients in the optimization process. And then implementation strategies means addressing common challenges like privacy and security and user adoption. And these sessions will give you the tools to enhance your EHR systems and improve care delivery. Now that we've explored the importance of EHR optimization, let's talk a bit about how Xpio Health can help you unlock your EHR's full potential. Our transformative optimization services are specifically designed for the unique needs of behavioral health. We understand these challenges, and we tailor our solutions to meet those specific needs. We take a collaborative, data-driven, and tailored approach. This means we work closely with your team using data to guide decisions and customizing our strategies to fit your organization. And with our proven expertise, we navigate the complexities of EHR systems so you don't have to. Our team has the experience and knowledge to ensure your EHR system is not just functional, but a powerful tool that enhances your ability to deliver care. Thank you all today for joining us and for exploring how you can learn to love your EHR through effective optimization. And remember, with the right approach and the right partner, your EHR can transform from a daily challenge into a powerful tool that enhances patient care and streamlines your workflow. At Xpio Health, we're committed to helping you make this transformation a reality through our collaborative, data-driven, tailored solutions designed specifically for behavioral health organizations like yours. We invite you to take the next step forward to unlocking your EHR's full potential. Let's work together to turn your EHR into something you truly love, because better systems means better care. Feel free to reach out to our team with any questions or schedule a personalized consultation, and together, let's work to make your EHR work for you.